Breast augmentation is a very popular procedure. Basically, a straightforward breast augmentation takes your breasts and makes them larger. We can certainly tweak or change a few things to get better symmetry is the goal. But I help patients based on their measurements and their normal anatomy. I help them pick a size that's comfortable for them. I don't tell them what they have to have, but I can give them a range of sizes to get to an appropriate breast or cup size in the bra. There's basically two styles of breast implants. There's saline or silicone. I help you decide between those and what are the advantages, the pros and cons of each. With breast augmentation, my goal is just to help you achieve the look that you're wanting. So we also do breast reductions. Sometimes a breast reduction and a lift are essentially the same thing. It's just a reduction reduces the breast size. And a lot of times that's just, again, to help a woman feel more comfortable in her own clothes and own skin, actually. So we definitely do those. And occasionally we'll do a breast reduction or lift with a simultaneous augmentation, meaning we use an implant, and the idea behind that is it helps create cleavage and kind of the fullness up top, which a lot of times has been lost with gravity. So a lot of times we'll do that. Okay. I think kind of an important thing as far as breast augmentation with me is, I help you decide what's best for you. I'm not going to tell you what you have to have. And the other thing is safety. I do all my breast augmentations in a hospital setting with an anesthesiologist in an operating room, so we like to offer sterility and safety above all. So women that are interested in breast augmentation, or who's the ideal candidate, it could be a girl that hasn't had any breasts essentially ever in her whole life and just desires fuller breasts and desires kind of a curvier look, or even an athletic look. It could be a lady that's had children or a child and just kind of looking for the mommy makeover. A lot of times after breastfeeding, women's breasts can look and feel kind of deflated, and we can restore that volume with breast augmentation. Or maybe it's an older lady that is looking to make a change and have more youthful breasts, and maybe we do the augmentation in conjunction with a breast lift, or like I said, even a reduction, but kind of give her more youthful, perkier breasts. Sure. So recovery for a breast augmentation or even with a breast lift or a reduction is typically around a week. With the augmentation or lift, you're waiting for the incisions to heal, and that typically takes about a week for them to kind of really heal. And during that time, they're underneath steri strips or butterfly band-aids and some special tape and bandages that I use. So for breast augmentation, especially if we go into the muscle, people are sore, and they describe it as a chest soreness, like they've maybe worked out too hard. They're given oral pain meds, and I'd say most of my patients take it for 2 or 3 days, but they may take it for a week. Very rarely do they ever ask for a refill, but if they do, I certainly don't want them to be uncomfortable. After I check them on the very next day after surgery, post-op day number 1, I'll start them on an anti-inflammatory like ibuprofen, just to take away that soreness. The first week, they wear a compression bra. That's to kind of, again, hold everything in place, kind of minimize swelling and bruising, kind of give everything a little bit of support. And they'll wear that for at least 1 week, but a lot of times they'll wear it for 3 or 4 weeks, and they don't wear an underwire bra until I tell them. I see them at 1 week, and at 1 week, I show them the incisions and how well, how it's healed, and kind of review the surgery with them. But I also might teach them some massages to start doing to kind of help loosen and kind of relax the tissues and help it kind of not feel so tight and tense. And these exercises also have shown to kind of help with the healing process.